This is Jerry Hesch from the Hesch Institute in Aurora, Colorado. And my 37-year-old patient is a PhD candidate, so she's been busy working on her dissertation. Also decided this would be a great time to remodel my house while I'm doing the PhD dissertation. So forgive the fact that I find that rather humorous.
It is very bad timing.
Well, you do have a little bit of hypermobility in your body. Not in the MP joint. I can only take that to 90 degrees, but then I can get a little bit of hyperextension on the distal joint there. And your hips are a little bit hypermobile. When I spring your rib cage, it feels like a little more mobility than I would expect from a person with your skin color and your age and your body type. So we have mild hypermobility throughout your body, and you have generalized joint pain in your knees and your wrists and hand and your shoulders, and of course neck and upper back pain. So I do recommend that you see a rheumatologist. You have pain in your left shoulder and down the left arm, and your shoulder range of motion was full in all directions. And so I'm very pleased to say it's probably not a rotator cuff tear. What I do find, I find two things with respect to your left shoulder. And one is that when I come underneath, I come medial to the scapula, so I'm probably on rib number 3. I have good spring mobility. The force translates through the rib joint, through the spine, okay? And through the shoulder complex. And this should be rib number 2, and that moves nicely. And then I come up and a little bit medially, and now I'm on rib number 1, and I'm using the same amount of force, and there's no movement. Okay? So I did this on both sides, and also when I come up in the midline and I spring T2, we have motion, and then this should be T1, but I'm off by one segment. Bingo, this is T1. I can't lift this up. And then I come above that onto C7, and we have good spring mobility. So both of your ribs are compressed, and whether that's from a soccer injury or from your car wreck long ago, nobody knows. Okay? Somewhere during the remodeling of your house, you stressed the AC joint, the acromioclavicular joint. This clavicle feels to be more posterior than the right clavicle. Now when I spring the right clavicle, I can load it, pushing it towards the floor, and then I spring it and it goes downward and it bounces right back. When I do the same thing on this side, I can load it, but then it stops moving. Okay? And what I think is that you have a compressed acromioclavicular joint in spite of having full motion. And that could be putting a little bit of pressure on the brachial plexus or even the blood supply going down your arm. So when I do a lateral at about a 45-degree angle, I'm going to spring, capturing the acromion. So I'm springing the scapula, and I'm able to load it, and then it stops. And after I load it, I can't spring it. Okay? Whereas on the right side, I can load it, and then I can spring it. It springs, forward, and it recoils backwards. So we have a stuck AC joint. We have a stuck T1 vertebrae, but I think the reason T1 is stuck is from both ribs being at end range. They got stuck at end range.
Okay.
Probably from a hyperflexion injury. So I think that's an old injury. Or, from a lot of prolonged sitting. Don't know.
Okay.
But I'm going to stop filming now. What I'm going to do to free up the first rib is I'm going to come underneath it and push it up, and you said that felt good. So I'm going to, with my index and middle finger, I'm going to create a little post, and I'm just going to lift up, and that will attempt to distract the back of the rib where it joins the transverse process and butts up against the first thoracic vertebrae. Then I want to pull the front of the rib outward also. So I want to basically take that C-shaped rib and I want to bring it away in the front as well. So what I'll do for the front part, while I'm using a little post, is that I'm then going to capture the acromion and push the scapula posterolaterally at a 45-degree angle obliquely, and that'll gap your AC joint. It'll pull on the clavicle. Clavicle attaches to the front of the first rib, and it'll pull that as well.
Okay.
So both of those maneuvers should free up your first rib. And I do have video on YouTube on self-treatment, mobilization of the first rib. So the viewer can find that video by typing in my last name, H-E-S like Sam, C-H, first rib mobilization. And then you can also find video using my last name and then AC joint or acromioclavicular joint. So I'll stop filming, I'll treat you, and then we'll come film the response to treatment.